Hi, I'm Aimee Rodrigues, editor of Aesthetic Medical Practitioner magazine. Our guest today is Dr Marjan Yazdian. She's a cosmetic physician. We're delighted to have her with us to explore how energy-based technologies are evolving and where they fit within a modern approach to skin. Welcome, Dr Yazdian.
Hi, Aimee. Thank you so much for having me.
Thank you for being here. Can you tell me a little bit about your practice and your treatment philosophy to start us?
My overall philosophy is holistic approach and patient-centered care. In my practice, I never seen the skin as an isolated organ. Skin is usually reflected by inflammation, hormonal balance, patient systemic health, lifestyle of the patients. It all together is affect the patient's skin. In cosmetic and dermatology medicine, we usually see every problem as a single concern. For example, aging, acne, redness, pigmentation. But the reality is, if we sit back and look at the skin biology, is all work together. If we want to treat one condition, we not be able to achieve the goal.
Right, that makes a lot of sense. So how do energy-based devices like lasers integrate into that framework? And how has their role in your clinic evolved as technology has advanced?
I personally don't run a heavy device laser clinic. For me, one device can target multiple issues would be the best. And as I said, when we treat, for example, an acne, we're treating vascular problem, we're treating pigmentation, texture, pore enlargement, and one device can treat all these concerns at the same time would be the best. And energy-based devices, in that case, play a big role.
Right. And at Cosmeticon conference, you presented on the Aerolase Neo Elite, which is described, as you described, as an all-in-one laser and for all skin types, which is important as well. So Neo's key differentiator is that it uses a long 1064 nanometer wavelength combined with a very short 650 microsecond pulse duration. What does that combination actually allow you to do differently in practice?
The Aerolase Neo Elite is an ultra short microsecond 1064 nanometers, which is provide the energy like a higher peak power in a shorter pulse duration. Which means when you want to treat, for example, an acne, you do the global passes, which is around 21 to 41 joules per square centimeters, and then followed by targeted passes, which is between 64 to 250 joules per square centimeters. However, even when you go on a higher fluence, it's still at 650 microsecond, which is very unique.
Right. So it delivers very high energy without bulk heating the surrounding tissue?
Absolutely.
Okay. So, laser skin resurfacing continues to evolve, but patient tolerance and treatment downtime remain key limitations. So the Aerolase.
That's absolutely correct, because with the 650 microsecond, you don't get any epidermal thermal collateral injury. And that's how it decreases the downtime. There's no pain with it. And it's just incredible result. Patient can straight away back to work, no aftercare. That's the beauty of it.
So not requiring anesthetic or external cooling, does that alter the way you approach treatment sessions or the types of patients who are willing to consider laser therapy now?
So this laser for any Fitzpatrick type is not going to produce any pain or downtime for them. The only, for example, condition we might consider cooling would be melasma. It's indicated for most of the patient with any of those conditions, with no need for concern for anesthesia in any age group.
The 650 pulse is designed to deliver energy, as we said, without overheating the epidermis. Why is that particularly important when treating inflamed, compromised skin such as acne?
That's a good question, because generally speaking, if you imagine acne patients are already mentally and socially affected by their condition, right? And if you use a laser and a technology that's going to add the redness and inflammation to skin, even for a day or two, it's affect their daily lifestyle. But with this machine, they can straight after the treatment go back to their daily life without adding any inflammation and redness to their skin. Also work on the melanin and epidermis and reduce the post-inflammatory hyperpigmentation and melasma, which is we always see mixed with acne patients, specifically if they have higher Fitzpatrick. And the third, work at the water epidermis and stimulate collagen and improve the skin texture, which means patient after one treatment, even I've always been told by a patient, even after one treatment, we notice a difference. And when they have the interval of like weekly treatment or every 2 weeks when they have active acne lesion, after 3 to 4 treatments, they notice significant improvement, like almost clear skin less than 3 months, which is not achievable with any machine without downtime.
Wow. Acne has traditionally been so difficult to treat. This sounds like a breakthrough for acne sufferers. Absolutely. And as you mentioned, acne patients are already often self-conscious. So to leave without that redness and to have the minimal, if any, downtime is such an advantage for them as well, and even in that aspect. So I'm conscious of time, so I'll finish with one final question. Looking at your experience so far with the device, what excites you most about this laser as you continue to explore it, and how do you see it evolving within your treatment offering?
So in my practice, laser never used by isolation. It's add to my multimodality treatment approach. My patients are on oral therapy if indicated, topical treatment, barrier repair, and device-based energy add to it and make a huge difference for patients' perspective and the result point of view. So I would say we're not just treating acne. We use the device to be able to manage multiple concerns at the same time, which is great.
Fantastic. Well, thank you so much for your time and your insight today, Dr. Yazdian.
Thanks for having me.